Welcome all future nurses to LPN LaunchPad. This session will focus on asepsis and infection control, critical concepts in providing safe and effective patient care. Asepsis refers to practices that prevent contamination by harmful microorganisms, while infection control involves procedures to reduce the spread of infections. Together, these measures are essential for ensuring patient and staff safety in healthcare settings. The importance of asepsis and infection control cannot be overstated. These practices protect patients from healthcare-associated infections, limit the spread of antibiotic-resistant organisms, and ensure safe, high-quality care. There are two main types of asepsis. Medical asepsis, or clean technique, reduces the number of pathogens and prevents their spread through practices such as hand washing and cleaning equipment. Surgical asepsis, or sterile technique, eliminates all microorganisms and is used during invasive procedures, such as surgeries. Infections occur when 6 interconnected elements, known as the chain of infection, are present. These include the infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and a susceptible host. Breaking any link in this chain helps prevent infections. The infectious agent refers to microorganisms like bacteria, viruses, fungi, and parasites. Factors such as virulence and resistance to treatment determine a microorganism's ability to cause disease. A reservoir is where pathogens live, grow, and multiply. Examples include humans, animals, water, soil, and medical equipment. Identifying and managing reservoirs is critical to infection prevention. The portal of exit is the route by which pathogens leave their reservoir. Examples include respiratory secretions, blood, and other body fluids. Controlling these exits reduces the risk of infection transmission. Pathogens can spread in several ways. Direct transmission involves physical contact, such as touching or kissing. Indirect transmission uses fomites, like contaminated instruments, or vectors, like insects. Airborne transmission involves pathogens traveling through air particles, as seen in tuberculosis. Pathogens enter a host through the portal of entry. Common entry points include the respiratory tract, gastrointestinal tract, broken skin, and mucous membranes. By understanding these pathways, nurses can implement strategies to block infections. A susceptible host is an individual who lacks the immunity or ability to resist infection. Factors influencing susceptibility include age, such as newborns or elderly individuals, chronic illnesses, compromised immune systems, and poor nutritional status. Nurses play a vital role in identifying at-risk patients and implementing preventive measures. Breaking the chain of infection requires consistent adherence to key practices. Hand hygiene remains the most effective method of preventing infection. Personal protective equipment, such as gloves, masks, and gowns, provides an added layer of defense. Regular environmental cleaning, including surface disinfection, is also critical in healthcare settings. Transmission-based precautions are measures used to prevent infection by addressing the mode of transmission. There are 3 types: airborne precautions, droplet precautions, and contact precautions. Each is designed to address specific modes of transmission to ensure patient and staff safety. Airborne precautions are necessary to prevent the spread of diseases transmitted by small airborne particles, such as tuberculosis. Key practices include the use of N95 respirators and placing patients in negative pressure rooms. These measures ensure that infectious particles are contained and do not circulate to other areas. Droplet precautions are used to prevent infections spread by large respiratory droplets, such as influenza. Masks are essential for healthcare providers, visitors, and anyone within 3 feet of the patient. This simple barrier reduces the risk of transmission through coughing, sneezing, or close contact. Contact precautions are necessary to prevent infections transmitted by direct contact or through contaminated objects, such as MRSA or C. difficile. Key practices include wearing gloves and gowns when interacting with patients or handling their equipment. These barriers help limit the spread of infection to other patients and healthcare staff. Healthcare-associated infections, or HAIs, are infections that patients acquire during their treatment in healthcare facilities. Examples include central line-associated bloodstream infections, catheter-associated urinary tract infections, surgical site infections, and ventilator-associated pneumonia. These infections are preventable with proper infection control practices. To prevent HAIs, adherence to hand hygiene protocols is essential. Aseptic techniques must be used during invasive procedures to ensure sterile conditions. Regular cleaning and sterilization of the healthcare environment are also critical for reducing the risk of infection. The body's natural defenses act as its first line of protection against infection. For example, the skin serves as a physical barrier, while the respiratory system traps microbes with mucus and expels them through coughing. The gastrointestinal tract uses stomach acid to destroy ingested pathogens, and the genitourinary system flushes out microbes with urine flow. Understanding these defenses helps nurses support and protect their patients effectively. The inflammatory response is a protective mechanism that localizes and removes pathogens while initiating tissue repair. Signs of inflammation include redness, heat, swelling, pain, and loss of function. Systemic responses, such as fever, an increased white blood cell count, and malaise, signal the body's effort to fight infection and heal. Infections progress through several stages. During the incubation period, the pathogen enters the body, but symptoms have not yet appeared. In the prodromal stage, early nonspecific symptoms, such as malaise or a low fever, emerge. The acute stage follows, with rapid pathogen multiplication and pronounced symptoms. Finally, during convalescence, the symptoms resolve as the body recovers and regains strength. Effective infection control relies on understanding how infections are transmitted and breaking the chain of infection. Consistent hand hygiene, appropriate use of personal protective equipment, and maintaining aseptic techniques are essential practices. These steps protect both patients and healthcare staff, ensuring safe and effective care. Key elements of assessment include identifying high-risk patients, such as those who are immunocompromised or have chronic illnesses. Nurses must carefully observe for signs and symptoms of infection, including fever, redness, and swelling. Reviewing lab results, such as elevated white blood cell counts and culture findings, helps confirm the presence of an infection. Monitoring infection progression is essential for preventing complications and ensuring the patient's care plan remains effective. Nurses track trends in vital signs, such as rising fever or changes in blood pressure, and assess wound healing to detect potential issues. Early detection allows for timely intervention, which can improve patient outcomes. Implementation of infection control measures is a key responsibility of nurses. This includes administering prescribed antibiotics to treat infections, ensuring proper use of personal protective equipment, and educating patients about infection prevention strategies they can practice at home. Each of these measures helps minimize the risk of infection spread and improves recovery rates. Educating patients and their families is a crucial aspect of infection control. Nurses should emphasize the importance of hand hygiene and teach patients to complete antibiotic courses exactly as prescribed. Additionally, educating patients to recognize early signs of infection, such as fever or wound drainage, encourages prompt medical attention when needed. Accurate documentation is vital for infection control. By recording the care provided, nurses ensure continuity among healthcare team members. Documentation tracks patient outcomes, monitors responses to interventions, and serves as evidence of adherence to infection prevention protocols. It is an integral part of providing safe and effective care. Infection control is not the sole responsibility of one person. Teamwork plays a critical role in maintaining infection prevention standards. Multidisciplinary collaboration ensures comprehensive care, with nurses, physicians, and therapists working together to align patient care plans. Regular updates and communication about infection risks improve overall safety and efficiency. Environmental cleaning is a fundamental part of infection control. Regular cleaning of patient rooms and common areas reduces contamination. Disinfection of frequently touched surfaces, such as doorknobs and bed rails, is essential for limiting pathogen spread. Additionally, sterilizing reusable medical equipment ensures patient safety during procedures. Leadership within healthcare settings drives the success of infection control efforts. Leaders establish infection control policies, ensure compliance among staff, and provide the necessary training and resources. By fostering a culture of accountability and vigilance, healthcare leaders can significantly reduce infection rates. Advances in technology have brought new tools to infection control. UV light technology is now used to disinfect hospital rooms effectively. Antimicrobial surfaces prevent the growth of pathogens on commonly used items. Automated hand hygiene monitoring systems also ensure that healthcare workers consistently adhere to hand washing protocols. These innovations enhance patient safety and improve outcomes. In summary, infection control is a shared responsibility among healthcare professionals. Understanding and applying aseptic practices are essential for preventing infections and ensuring patient safety. Continuous education, collaboration, and the adoption of new technologies drive progress in infection control. Let us remain committed to these principles to provide the best possible care for our patients. Let us dive into our first practice question. The question asks, what is the primary purpose of medical asepsis in infection control? Your options are A, to eliminate all microorganisms and their spores, B, to reduce the number of pathogens and limit their spread, C, to destroy all microorganisms in surgical environments, or D, to protect healthcare workers from harmful exposure. Take a moment to think about the question and choose the best answer. Ready for the answer? The correct answer is B, to reduce the number of pathogens and limit their spread. Medical asepsis, also called clean technique, is all about reducing the number of harmful microorganisms and controlling their spread. It's commonly used in daily healthcare practices like hand washing and cleaning equipment. This is different from surgical asepsis, which aims to eliminate all microorganisms. Now let's move on to question 2. Which of the following is not a component of the chain of infection? Your options are A, infectious agent, B, susceptible host, C, aseptic environment, or D, mode of transmission. Think about what you know about the chain of infection and identify the best choice. The correct answer is C, aseptic environment. While the chain of infection includes components like infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host, an aseptic environment is not one of them. Instead, creating an aseptic environment is a strategy used to interrupt the chain and prevent infections. Here is the final question. What is the most effective method to prevent healthcare-associated infections, or HAIs? The options are A, using personal protective equipment, PPE, B, hand hygiene, C, environmental cleaning, or D, administering antibiotics. This is a critical topic in infection control, so take a moment to consider your answer. The correct answer is B, hand hygiene. Hand hygiene is universally recognized as the most effective way to prevent the spread of infections, including HAIs. By washing hands or using hand sanitizer appropriately, healthcare professionals can break the chain of infection and protect both themselves and their patients.
Hey there, this is Brian. I am the creator of LPN LaunchPad. I want to say thank you for learning with us. In addition to these videos, I've created a series of free adaptive quizzes in ChatGPT. The link to this video's quiz will be listed in the description below. Help me keep this project alive by hitting the like and subscribe buttons.